The main theory that we found that was important to mention behind the behavior of the state of the COVID-19 vaccine was how the economic environment behaved. The main managers of the vaccine, for example, Pfizer or Moderna, was built based on a financial fund, for example, the Vanguard and BlackRock, who made a stock market based on the intellectual property. So it was pretty important to mention that some trends, such as the TRIPS, bid and FTAs, was part of the specific right on vaccine terms. The liberalism explain how the concept of the free market make this concept more deeper based on how they manage their market, and also how the constructivism was a fundamental part of raising a monopoly based on raising a policy on how some of the stock market owners, especially the states, should apply that policies in order to affect how, for example, the World Health Organization consider a market rather than actually being a public good. Also, the contrast for the prevalence of coronavirus vaccine, despite the fact that 8% of the total of them were public and also based on philanthropic funds. This term was also related to how the Marxism refers the concept of the public and the correlation with the market, and how this monopoly logistics make a little bit difficult, especially for countries like India or Africa, to get the vaccine. Y ya.
Assuming that the national security and self-interest are paramount. The tendency for countries to seek to be the first to receive a vaccine, even at the expense of the global community, appears to be a disadvantage, which is occurring in the way that the story predicted class realism. Furthermore, according to this theory, countries will not be able to do everything in their power to get the maximum dose of the vaccine as quickly as possible. In general, classical realism predicts that vaccine nationalism will persist and that individual states will value the distribution of vaccines to their cities above the other concerns. Countries with likely no existing international commitments will not contribute to global vaccine distribution efforts, such as COVAX, but we intend focus entirely on vaccine procurement for the country. Two, two notable successes are those of the United States and Russia within the COVAX organization.
Liberalism theory is focused on the effects and benefits of international organizations and NGOs in promoting to cooperation and mutual gains for membership and participation. And in the context of COVID-19 and in the context of pandemic, the World Health Organization create a global access call it global access organization for the vaccines call it COVAX. COVAX it's an organization to establish the facility to access to the vaccines. The main objective of COVAX, especially for low-income nations, he should predict that the nation would choose to buy the initiative in order to reap the benefits this membership will provide. In that aspect, in a specific case of COVAX, the benefits appear to exist both low income and high income countries. The expected benefits to should help facilities cooperation and the COVAX have the more countries that they don't have a source to pay the all and they can develop a new vaccines, and it's too effective to countries in international cooperations help the nations that don't have that resource, and it's keep in instead of the liberalism countries that chose to engage with NGOs to accelerate efforts to distribute the vaccines globally and putting ration and cooperation of the far from of their decision making.